Welcome to Community Voices with your host, Tarence Lauchie. This radio roundtable features community, business, and religious leaders that discuss current events and topics that impact our urban community. If you would like to be a guest or if you have a suggested topic, contact the station today at 616-259-7342. Now, into the program.
Well, welcome back. This is Tarence Lauchie, and you're tuned in to another edition of Community Voices on 91.9 FM, The People's Choice. I'm blessed with the opportunity to have a medical doctor and psychiatrist in the studio today. Most people say I need a psychiatrist, so I'm in the right place. Dr. Berhere, welcome.
Thank you so much. Thanks for having me here today. It's a pleasure.
Thanks for being here. We're going to talk a little bit about specifically children's psychology. We'll talk about some depression, maybe signs of depression, and perhaps just mental health. You know, the whole concept of wellness and center around that. Tell us a little bit about what you do with the UofM Health West.
Absolutely. So I've been with the organization since early this year.
Okay.
I'm the clinical chief for psychiatry at University of Michigan Health West Department of Psychiatry. I'm also a pediatric psychiatrist, and so I specialize in working with young kids who may have mental health needs, and kids who may also have other medical issues and are having psychological reaction from having a chronic medical illness. Mm-hmm. And so things that I see kids for are commonly anxiety, depression, ADHD. I do an assessment, assess if they need medications, and also refer kids for therapy and what may be other appropriate treatment modalities.
Sure.
So, yeah.
What made you decide to go into this particular area? Children's psychiatry is probably more complex, if not as complex, but probably more complex than adult psychiatry.
Absolutely. So, I grew up around a lot of mental health providers. My father is a psychiatrist. My mom was a psychiatric social worker, and I have other family members in this field. So kind of grew around.
So it's a family business.
Exactly.
Okay.
So I grew around that. And kind of took inspiration from my fathers, and that was one of the reasons I went into psychiatry. And interestingly, with child psychiatry, I wasn't really interested in going into child psychiatry. I always thought, I'll be an adult psychiatrist working with the adults. But when I was in my training, I had a great mentor. And he kind of, convinced me to go into child psychiatry, and I worked with him for a little bit, and then kind of decided that this is what I really, really want to do, and so here I am. So trained, did the fellowship in child psychiatry, and then kind of never looked back after that.
Great. So you jumped right in. Plus the family influence, right?
Right. I think that played a little bit of a part in that as well. So.
For those who might just be tuning in, I'm Tarence Lauchie, and you're listening to Community Voices on 91.9 FM, The People's Choice. I'm talking to Dr. Berhere from the UofM Health West. That's the University of Michigan. It was hard for me to say that, being that I'm a Spartan through and through. But you tell me a little bit about your split loyalties. You've got some Spartan training and UofM practice.
Correct. So I'm employed with University of Michigan Health West, but I also have an academic affiliation. So apart from my clinical work, I'm also heavily engaged in kind of the academic part of medicine. So I teach medical students, residents, and fellows, and have an academic affiliation in the Department of Pediatrics at Michigan State. And I'm an assistant professor there.
So you're a double agent.
You could say that, yeah.
Go green, go white, go blue,
exactly.
go gold, right?
I think I'm just being diplomatic. So
yeah, that's cool.
Yeah, so I enjoy working at University of Michigan Health West, and I also enjoy my teaching role and other scholarly activities at Michigan State. So,
well, it makes sense, though, and I think in the field of medicine in particular, you can't have loyalty to one with not loyalty to all, because you're in the field of really helping people.
Exactly.
And you told me your reason for going into it was some family influence, but you obviously have a passion for kids and young people. What are some of the things that we should be concerned about as it relates to the mental health and wellness of children, because you're in psychiatry. By the time a child gets to see you, he or she has had a whole host of issues and problems. So let's talk a little bit about some preventative things and then talk about some treatments.
Right. And I think another important thing working with kids is, I think you can really have a big impact on trajectory.
Yes.
So recognizing anxiety and depression in a 7 or 8-year-old versus, if they have gone untreated and are adult, can have a significant impact on what the treatment outcomes are. So we want to try to recognize symptoms of anxiety and depression as early as possible to have the maximum benefit. So that kind of makes my work quite gratifying, that I can have an impact on the younger population.
Sure.
And as you can imagine, in the last 2-3 years with the pandemic, the level of stress has gone up significantly.
Oh, absolutely.
Whether it's parents, it's kids, it's teachers, it's
school,
providers.
Health.
So it's been a great deal of stress in the last couple of years, and then with the recent events of just violence within the country, war in Ukraine. I mean, there are other external stressors that's affecting everyone. Climate,
Sure.
How floods in one part and also drought in other parts of the world. So there's significant stressors present, and I think that's affecting everybody. So we've definitely seen rates of anxiety and depression going up in kids as well as in adults. So I think this is, an important time to recognize some of these signs. So if someone is struggling with that, you can kind of get the right help. In respect to anxiety and depression, if you notice that the child is more withdrawn, appears sad, changes in sleep or appetite, not as interested in school activities, could point towards symptoms of depression or anxiety. Kids, especially when they're depressed, they tend to be more irritable and angry. Versus if you look at adults, when they're depressed, they look depressed to you. But
Yeah,
when
you can read it.
Exactly. So if anger or irritability can also be a sign of depression in children. In respect to anxiety, they can have a host of physical symptoms, what we call somatic symptoms. So like headache, upset stomach can also be a symptom of underlying anxiety. So those are some of the things that we need to watch for. And, anyone can have like a bad day where they're not feeling great or have, feeling anxious. But if you have periods where, you're feeling depressed or sad or anxious for weeks, 1 to 2 weeks or even longer, and it starts to interfering with your ability to go to school, your function at home or your work, then it's time to maybe, talk to your provider and seeing if you can get more help.
I think that kind of leads into the question that I had now is, when should someone go to get help? When they start seeing these symptoms or when they suspect these things. Sometimes when a child gets in trouble in school, it's because they probably, blown past, parents or caretakers might have blown past a lot of the symptoms of some issues. What are the programs that are available at UofM West, Health West that can help besides just simply seeing a psychiatrist?
Absolutely. So, this is a exciting time to be in psychiatry, and we have a new program that we are developing and growing very rapidly. So the program started end of last year, fall of last year, and we are rapidly hiring people. And by end of this fall, we'll have a total of 6 providers. We'll have 4 psychiatrists, 2 who specialize in pediatrics and 2 who specialize in adult, and 2 advanced practitioners.
Mm-hmm.
And the model that we've gone with is kind of a unique model. We have decided to integrate psychiatrists and providers into primary care offices. So instead of going to a mental health clinic, you would go to your PCP's office and you would be able to see a psychiatrist there, which I think greatly increases access for people, reduces stigma. People, when you talk about referring someone to psychiatry, there's some hesitation with that. But, now you're just going to your PCP's office, your primary care office, which you've been for a long time. And so it helps kids just be more comfortable as well as adults.
Sure.
And so that's one kind of side, we're developing. We're also hiring therapists who, again, are going to be integrated into primary care offices. So when you come there, you can see a psychiatrist, and when needed, you can also see a therapist. And as we look into growing the program, we'll look at hiring psychologists and other people who can do more testing as we grow the program. And so kind of really meeting the need of the system and the community within one place, one building.
Sounds like a one-stop shop for complete health, whether it's mental, emotional, or physical health. Let's talk a little bit about some of those stigmas that are associated. Black and brown communities in particular are probably less likely to pick up the phone and say, yeah, I need to talk to a psychiatrist. Sometimes they'll get a referral to a therapist, which is psychology, and then ultimately make their way through this process. But how do we bridge that gap and address those stigmas or stereotypes for Black and brown people?
Absolutely. So, I think the stereotypes exist. I think, there's a big cultural component in terms of, how one approaches mental health providers. And I think that's where the primary care physicians can play a huge role in really working with people of community, to kind of convince them that, if they are struggling with anxiety and depression, this is more of a medical issue. Whether if you had diabetes or a high blood pressure, you would go and see, your medical provider.
Yeah.
So this is similar. There's imbalance. There is, and seeing this from a medical perspective and not differentiating these are mental health issues and these are medical issues. It's all under one umbrella. And so I think primary care physicians can play a huge role because, people trust their PCPs or primary care because they've been seeing them for a long time. Mm-hmm. So that's one approach. The other is, I think, faith leaders. I think they can have a huge impact. Church leaders, people from the temple, from the mosque, people who work within that ethnic group, who people trust, can also serve as a way of kind of referring patients to, provide specialists when they feel that they're struggling.
Yeah, what do you think is root cause of some of those stigmas that people would avoid mental health care?
I think, first of all, I think it goes back to if you are struggling with a mental health issue, there's something wrong with you. Mm-hmm. And, in some ways, you're putting the responsibility on yourself. It's all in the head, right? And so maybe you are responsible for this, or you have the ability to, intentionally cause this, or you've intentionally caused this. So I think that kind of a blame in terms of, why you're suffering from anxiety and why you're suffering from depression, and then associating that with, maybe you're weak in some way. Mm-hmm. So I think that's one aspect of it. But I think, people from the minority community in general have a hard time accessing healthcare. So not just mental health care. I think, there's a bigger disparity in mental health care. But I think in general, I think that goes back to, access, trust, and then, insurance, and there are other factors that play into it.
The social norms among those cultural groups.
Exactly.
Yeah, we toss the term around often, when somebody's acting silly or being jovial, oh, you're so crazy. And then when somebody has mental health issues, oh, she's crazy. And those stigmas, I think, have a tendency to affect us negatively and prohibit people from actually wanting to go and get the help that may be available. Right.
And so one way I approach this is, I always give them example of, let's say someone had diabetes or someone had hypertension. You would easily go to your health provider and say, I'm struggling with this, or they diagnose you with diabetes or hypertension, and they will prescribe you medications, right? Similarly, with any mental health issue, whether it's depression, ADHD, or anxiety, or schizophrenia, seeing it from a medical point of view and treating it as a medical issue, and not differentiating and trying to separate, this is mental health, this is other medical issues.
Sure. I think that would help a whole lot. What are you seeing coming into the office most recently? You mentioned that, of course, with the onset of fear associated with COVID, and then the visualization of traumatic experiences. We've seen people literally killed on the news, by police officers, or we see footage on social media of shootings and and things like that. What are some of the outstanding things that could cause concern that we should be aware of as parents? I'm thinking now for the listening audience, that would be the parents, the grandparents. How can we help out?
I think, first of all, recognizing. So, you don't have to experience the trauma directly to be affected by it. Watching traumatic events on television, reading about it.
That would be considered like secondary impact.
Exactly.
Yeah.
It can lead to secondary trauma. And these symptoms are very real. So whether you're there in the moment when the event happens, or you're reading about it or watching afterwards, you can still have symptoms of PTSD or post-traumatic stress disorder. So I think, as parents, we need to be aware of, things to watch out for. I think during these times, I think it's very important also be to close to our children and, kind of give them reassurance and stay close to them to make sure they feel safe and they know that we are, looking after them. But also at the same time, recognizing, signs of anxiety and depression. And really, if they are worried about it, then trying to seek help early on. As we know, the earlier you intervene, the better outcome you may have down the line. Yeah.
So it's important to have on some tentacles of receptors, if you will, of assessing situations.
Absolutely.
Should I talk to my kid before they go to bed tonight after watching or after having seen something? Or when they wake up from night terrors or dreams, how do I walk them through those kinds of things? I'm just kind of thinking of some very practical scenarios in which a psychiatrist or a psychologist would be able to assist.
Yeah, so I think I can maybe talk broadly. So I think, sometimes we feel, not talking about things is a better approach.
Like we don't talk about Bruno.
If you don't talk about it, it doesn't exist. But I think that's not true. And, so I think recognizing as parents, that something has happened, and it's important to talk about it because we have emotions and we have reactions to situations, and kids can equally have that as well. So I think being forthcoming with children, and if a traumatic event happens, talking to them about and kind of helping them process their feelings is, I think, the first step. I think talking about it and getting the feelings out is the first step. And working with kids, I think like I talked about, making sure they feel safe and reassured. Kids can have difficulty sleeping initially if they are, if they experience a traumatic event, whether they witnessed it or they've been part of the traumatic event.
Right.
So really kind of, helping them, making sure they're sleeping well at night, they feel secure, and having a good bedtime routine. But with all the chaos that's happening, I think it's also important to have a good schedule that you follow, and this is, I think, good value for
adults,
both
adults as well as children. I was just thinking, the older I get, the more I realize that how important it is to have a bedtime ritual.
Right. Yeah. So yeah, absolutely. I think so. I think having that good schedule can help tremendously. It kind of bring you back into a set routine, and it can also serve as a good distraction from what's happening. Avoiding or at least limiting exposure to social media, especially for young kids. I think, being aware of what's happening is different than, watching social media or news or reading about it excessively.
It almost validates their fears oftentimes.
Right, and that can heighten anxiety significantly. Sleep is very, very important. I mean, if I had to say one thing that, you take from this talk is the importance of sleep.
Yeah, I heard you mention that a couple of times. Yeah, talk a little bit about the significance behind sleep and mental health.
Sleep has such a crucial part in not just mental health, just physical health in general.
Oh, yeah.
So, with the daily exposure to, social media, both adult as well as kids, we are inundated with news, information. We're always like scrolling social media, and that can have a direct impact as well as an indirect impact on our mental health. With kids, being bullied online on social media and things like that, they can have a negative psychological impact. But also the excessive amount of exposure of light to your brain, especially at nighttime, suppresses the melatonin in the brain. And melatonin is a compound that's found naturally that tells your brain when it's time to go to sleep.
Mm-hmm.
And so when you're scrolling on your phone at night, 10 p.m. on your bed, the brain thinks, well, it's not time to go to sleep because the light exposure suppresses the melatonin level in your brain.
Yeah.
And then you have a hard time falling. And then when you have a hard time falling, you're again back on your phone. So it's a vicious cycle.
And then before you know it, you become
exactly
an insomniac. You're like,
Right.
I can't sleep enough.
Right. And, there are medications that can be helpful, but really I can't emphasize enough the importance of, these basic things before you go to sleep. So limiting exposure to, phone, at least an hour before bedtime, avoiding really strenuous exercises before bedtime. Anything that increases the core body temperature can interfere with sleep. A warm bath can be helpful. And then, not having a meal too late before your bedtime.
Sure.
And all these small things add up. And, if you're sleeping well, I think, you feel well the next day versus if you had a poor sleep or you woke up several times in the nighttime, you're not functioning well the
Sure.
following day, you're more irritable. And that's just a mental health aspect of it. There have also been studies linking high blood pressure and diabetes to poor sleep. So
Sure.
it's a host of
I like that.
cascading effect that you can have with poor sleep.
Well, I definitely like the fact that you're bringing all of these other health issues into the discussion or the conversation. But UofM Health West offers a variety of services and a variety of health resources. How can people approach your office or your division within the system?
That's a great question. So as we are growing our department, the best way to reach out is through the primary care offices. So if you feel yourself or your child needs to see a mental health provider, talking to your primary care physician, and then they are able to place a referral to our clinic, and we can get someone scheduled in pretty quickly. As I said, we're growing pretty rapidly, so we have a lot of providers joining in the next couple of months, and so we are able to take people in very quickly, and then based on that, seeing a psychiatrist does not always mean medication. I think people
Sure.
equate seeing a psychiatry to medication. So
Right. We think psychology is just talking to a therapist,
Right.
and psychiatry is
Yeah.
when medicine's involved.
Right. So, maybe I could talk a bit about that. So I think, what we do is is the first point of contact. We see someone, we do an assessment. If we feel medications are helpful, we have a discussion with the family or the person
Mm-hmm.
involved. And if we think, therapy would be crucial or helpful, we refer them out. If we feel some form of testing would be needed for a diagnostic evaluation or clarification, we can make those referrals. So this is, I think, the first point of contact, and based, on the evaluation, we can recommend a host of other services. That's not medication, but medications are very helpful in certain cases.
Sure.
But depending on the severity of the illness. So psychiatry does not equal medication. Yeah.
Well, the healthcare provider would be the place for the referral, but I was looking specifically for the website for people to be able to make contact, or even to tell their physicians, hey, I think I need to get a referral. So what is the website for that?
I think it is University of Michigan HealthWest.org.
UofMHealthWest.org. I remember it now.
Yeah.
I keep stuck on that U of M thing. That's what it is. But no, it's wonderful. They're partners here with the station, and I've had quite a few of the physicians and department leaders sit in that chair.
Oh, wonderful!
And
yes.
we've talked about the different menu of items that would be providing good health care for our communities.
So I think it's UMHealthWest. I think .org is the website that you can get more information on.
Great. Tell us other things that you might want listening audiences to know, about what you do and about the services that you provide.
Absolutely. So I thought I could cover a few other areas that may be of interest. I think,
Sure.
one thing I wanted to maybe address was, just how to stay healthy and positive during these tough times.
That's
right.
good.
And just just touching about a few things that I think would be helpful. So we talked about maintaining a good routine and schedule, the importance of sleep.
Mm-hmm.
Exercise. There's, more and more evidence coming out linking strength exercises or workout with decrease in level of anxiety.
Wow.
So
strength training versus cardio. Cardio causes anxiety to increase. Strength training causes it to decrease.
Well, I think all forms of exercises are helpful in reducing level of anxiety and improving, elevating mood.
And that's because of the chemicals that are produced.
Exactly,
Yeah,
and the
like
endorphins, and I think just if you feel well physically, you'll feel well.
And
mentally.
if you look good, that helps you to feel good.
Absolutely. But yeah, the recent research I've seen is with strength training, so definitely for reducing amount of anxiety.
So I've got sleep, strength training.
Yeah.
What else you got?
I think outdoor activities play a huge role.
Exposure to the sun, right?
Exposure to the sun, and also I think this concept of kind of forest bathing or just being out in the nature. Mm-hmm. So going for trails and walks and things like that can have just a tremendous benefit. I think they kind of help you distract from your day-to-day hustle, and also just being in nature I think is a great anxiety medication.
Well, the change in scenery when we're used to the same mundane patterns of work and school and home and work and school and home. It's probably healthy to get out of those environments that we're so used to and try something different.
Absolutely. Eating healthy. I mean, again, that's just having a good balanced meal. Social interaction can also have a really positive benefit in terms of how you're feeling mentally.
Sure.
So I think those all small things add up, and if you are doing these all things, I think, and taking care of yourself, and also I always tell parents that you need to take care of yourself before you can take care of the child.
Yeah, well, they tell us that on the airplane when we're about to put the masks on.
Exactly, yeah.
They say put your mask on first before you help somebody else.
So as parents, check in with yourself and see how you're doing. Make sure you're doing well, and if you're doing well, and then taking care of your child, and so because children model what parents are doing, whether it's how they're feeling or whether it's the amount of phone they're using. So modeling good behavior I think goes a long way.
And showing the children that you don't have to have a phone attached to you at all times, right? Let me ask you this in our last few minutes. Let's try this together. And I think there are people of different walks of faith, but how would you connect faith or spirituality to the wellness and the mental wellness field?
I think it goes back to belief. I think it goes back to social connection. Believing in studies have shown that believing in a higher power can have a positive benefit from a mental health perspective. But I think, when you're part of a faith group or religion, I think it can also serve as a good social connection. So, for example, if I go to a temple, I interact with people, socially. I get to meet my friends and talk. And so I think, there's multiple aspects of how faith can have a positive impact on one's mental health. There's a great article on the National Alliance of Mental Illness website that talks about role of faith and how it relates to mental health of a person. So.
Great, and that's on the website for the National Alliance of
Mental Illness.
Mental Illness.
NAMI. Yeah.
That's awesome. I think that'd be great. Anything else before we wrap up?
I don't think so. I mean, I think we talked about some. Hopefully, listeners will take find it helpful what we talked about.
I definitely have a different perspective. Also, in answering the question between the differences of a psychiatrist and a psychologist in the fact that they work together along with primary healthcare providers.
Absolutely, yeah. We work very closely with them. And so psychiatry, psychology definitely works very close together.
In primary healthcare.
I get asked often about how to deal with excessive social media use.
That's probably really
kids,
big.
Yeah. So with kids, right now, especially when the pandemic was started, everything turned virtual. So kids were attending school virtually, and they were on screen most of the day.
And they were told by their teachers, log on to your computer. And you go, what?
Right. And and so the American Academy of Pediatrics had these guidelines, for like less than 18 months of age, should not have any screen exposure. For age 2 to 5, 1 hour, and older kids and adults, older kids, not more than 2 hours. But I think there's another way to look at that instead of focusing just on the number of 1 hour, 2 hour. I think focusing on what the child is doing apart from the media use. And then if they're able to complete all these other tasks, then you can be flexible about how much media time they use. So I think just kind of a different perspective on how you approach screen time with the kids. So are they getting enough sleep? Are they getting enough exercise? Are they spending quality time with their family? Are they doing the homework that's required of them from school? Are they spending time with friends? Are they engaging in hobbies and outdoor activities? And if they're doing all these things, then I think there can be some flexibility about the time they spend on social media. Another great way to do is watching things with the kids together versus them watching something in one room and you're watching something in another room. So I think that's also quality time as family.
Yeah, the shared screen time probably just kills two birds with one stone, right? We'll watch this, we'll turn it off, we'll talk about it, go for a walk, maybe go grab something to eat, as opposed to just hours and hours and hours of scrolling. So that's probably one of the biggest concerns.
So when someone asks me about how much time they should be spending on screen, I approach it from a different direction and say, okay, let's talk about these things. And then, whatever's left, they can be.
So it won't be more of a penalization. Sometimes people feel as if you're taking something away from them when you say don't spend as much time on social media.
And then it can become a power struggle with the kids. So
absolutely. Well, closing thoughts or words maybe to the listening audience, maybe words of encouragement, then of course more contact information.
Absolutely. So, I really appreciate you having me here today.
Thanks for coming.
So I think, I would say recognizing signs of anxiety and depression in kids. If you think someone is struggling, whether an adult is struggling or a child is struggling, reaching out to your primary care physician to seek help. Importance of exercise and sleep. And also as parents, check in with yourself and make sure you are doing well, before you are taking care of your kids. So I think the parent, Well,
thank you so much for sharing. People can reach you through the website?
Absolutely. Yeah.
Okay. Yeah. Great. Well, that's UofM Michigan West. Is that correct?
It's.
You got to help me out.
I think it's UMHealthWest.
UMHealthWest.org. UMHealthWest.org. Dr. Mahari, thank you so much for being here today. This is Tarence Lauchie. You've been listening to another edition of Community Voices on 91.9 FM, The People's Choice. Hopefully we'll have you back again soon.
Absolutely. Thank you so much.
Thanks for being here.
You've been listening to Community Voices with your host, Tarence Lauchie. Community Voices can be heard every Friday at 12 noon. This radio roundtable features community, business, and religious leaders that discuss current events and topics that impact our urban community. If you would like to be a guest, or if you have a suggested topic, contact the station today at 616-259-7342. Until next week, let your voice be heard in the community.